Hello, and welcome to the Thomas Nelson Community College EMS Program's Clinical and Field Orientation video series. In this segment, we are going to cover how to properly document all patient contacts and skills performed while attending your hospital or clinical shifts. Begin by logging into your JB Learning account. Once there, select the class that you are currently enrolled and launch the Navigate to dashboard for that course. At the upper right-hand corner, select the FISDAP hot link, which will drop you into your student profile on your FISDAP account. As previously discussed, when you are nearing the end of your field or clinical shift, you will need to document all of the patient contacts and skills you perform throughout the day. In order to do that, you need to access the shift you are currently attending. Click on your Skills and Patient Care tab to bring up the list of shifts that you have been assigned. This video is going to cover how to document your hospital shifts, which are located in the green. Open your shift up and navigate through the page once it loads. You need to confirm that the information at the top corner is correct, the date, the time your shift started, and the location that you are currently attending is listed. You will then scroll down and see a couple of different places to document items. The first area are your patients. You will click on Add Patient button to put in your patient contacts. There's a second section for attachments. The next section are your quick skills. Maybe you didn't do a patient interview, but you were able to go in and perform an IV on a single patient. You can document those here. And finally, at the bottom are the shift evaluations. There are 4 that need to be completed for your shift to count once locking it at the end of your shift. Let's start with adding a patient. When you click the Add Patient button, it brings you up to an EPCR, or an patient care report that you were able to log on a website. The first thing you need to do is select your preceptor. If your preceptor is located in the drop-down box, you may select it. Most of the time, you will need to add the preceptor in manually. Once your preceptor is loaded, you need to start going through all of the fields. For each patient you come into contact with, you will need to answer the first 2 questions. Did you perform the patient interview? And did you perform the exam? Next, you will need to enter the patient's age and their gender. When you are documenting a newborn at your labor and delivery shifts, or if you have a delivery in the field, you need to document their gender, but you put 0 years and 0 months. This will allow FISDAP to recognize that this is a newborn patient, and you will get credit for having a newborn contact. Next, you will need to answer the patient-required airway management. If your patient did require airway management, you need to select that. And then you need to choose whether you managed the airway successfully, unsuccessfully, or you did not manage the patient's airway. Next, you will fill out your AVPU and then your chief complaint. Scrolling down, you will then Do a primary impression, followed by a secondary. Patient acuity, and then you will begin to document each vital sign or skill that you performed. Let's start with vital signs. When you first open your vital signs tab, there are only 4 to record. You need to click the More button to bring up the rest. You then need to select whether or not you obtain vital signs and put them in. Once you have completed all of your vital signs, you will need to save it. Next, let's look at the airway tab. This goes in conjunction with the checkbox that I asked you to select earlier, whether or not the patient required airway management. If so, then you need to click that you perform this treatment to match what you have selected up top. Let's look at the procedures because there is some confusion when documenting these. The procedures listed in the drop-down box are listed in alphabetical order. Simply administering oxygen to a patient is not airway management. That is a medication delivery. However, placing a patient on CPAP, supraglottic airway, or even intubation, that is airway management. You can get airway management with a nebulizer treatment as well as a medication administration. Next is your cardiac section. This is where you will place the rhythm that you noted on the monitor, whether you interpreted the rhythm, and if you performed this procedure or not. Any chest compressions you do also fall in this category. Next is your venous access, central line, IVIO, etc. Your size, location where you started the IV, and type of fluids you gave. It's important you document how many attempts and whether or not you were successful. Next is your medication administration. Make sure you put the right dose in the correct route, and then whether or not you perform this. Finally, you have an other section that includes all of your bandaging and anything else that you may cover. Again, when you do a procedure, if you did it, you need to click I perform this treatment. If you do not select I perform the patient airway, I perform the exam or interview, or I perform this procedure, it will drop you into an observed category and you will not get credit towards your graduation requirements. Once you've completed documenting all of your vital signs and interventions, you are now ready to start your narrative. Please write your narratives as if you were going to court. This is a great time to practice how you would document each of your patients in the narrative section. You should have already had practice doing this in your lab sections, and this is just more practice for you to do before you are released as a paramedic or EMT in the field. Make sure you sign your narrative when you are completing it. Next, you can choose to either add another patient or review shift documentation. Once you have entered in all of your patient contacts and skills that you completed during your hospital shift, you are now ready to have your preceptor sit down and review all of the information. They're going to want to look at all of the patient contacts that you have entered into your FISDAP profile, and then they will be able to sign off on your shift once they are satisfied with your documentation. To get your preceptor to sign off on your shift, select that link. Here is where your preceptor will document all pertinent information on your performance. They can also list a plan of action, what they would suggest or where you could work on or improve. And lastly, they will sign off on your shift. Once you've obtained the signature, you must click the sign off button. This will automatically close your shift for the night. Remember, all shifts will lock within 24 hours of completion if you have not manually locked them yourself. Before you lock this shift and it is 100% complete, you need to go in and make sure that all of the evaluations were filled out before you shut it down. You need to go through and select all of the appropriate information and then close it. You will do this 4 times. Once all of your evals are completed, you can then lock the shift. It will tell you if you are missing any information. Once a shift has been locked, we will not be opening that shift up for any reason. If you lock the shift before you get a preceptor signature, you will need to track down that preceptor, contact your clinical coordinator, and that is the only time we will unlock a shift. If you have problems documenting all of your patient care, say the Thomas Nelson website is down, FISDAP website is down, or you do not have access to a computer, take these forms with you. They are clinical internship field evaluation worksheet. They are located at thomasnelson.edu/fire and EMS under the Emergency Services Professions. They are listed as Thomas Nelson Clinical and Field Competency Tracking Form. You will then fill this out, have your preceptor sign off on it as you would the FISDAP, and it will later be uploaded once FISDAP is available. If you have any issues while attending your hospital shifts, you must step aside and contact your lead instructor and clinical coordinator either by phone or by email to try and resolve that issue. If you have any questions, please contact your lead instructors or clinical coordinators. That concludes this video series on how to document your hospital shifts. Thank you.